Hello, my name's Julie Reeve, the Consultant Nurse for Emergency Medicine, and in this session I'm going to talk to you about patient group directions, or otherwise known as PGDs. We're going to look at some background information. What is a PGD? Where have they come from? Who can use them? And then talk about the specific training needs for that PGD. So the legislation covering the use of medicines goes as far back as the Medicines Act in 1968. And basically that governs everything we do to do with medications. And medications are legally classified, and the three groups I'm going to talk about are GSL, P and POM. GSL is general sales list, and that's what you can buy down in your local Tesco's or at the garage. A P is for a pharmacy only medication, so you have to go to the pharmacy counter and ask for that medication. And then a POM is a prescription only medicine, and that's what we are used to dealing with working in the hospital. So in hospital, all medication is regarded as prescription only medicine, so that is why we need a PGD for something, or a prescription for something as simple as a paracetamol. So we can't just give our patients something that they might be able to buy over the counter. So to supply, administer any medication in the hospital setting, it either needs to be prescribed by a registered prescriber, a doctor or a non-medical prescriber, or we can actually administer that medication under the use of a PGD. So where do they come from? Well, they started off as group protocols as far back as 1998, and it was in primary care in some nurse-led clinics where they first were used, and it was basically making the most use cost effectiveness of the staff and trying to make the services more efficient. They then evolved to become patient group directions, and legislation was changed in August of 2000, and that's when they became patient group direction. So what is a patient group direction? Well, it allows certain health professionals to supply and administer specified medicines to patients who fall in a particular group as defined in the PGD, and we'll look at the detail of that later. But what a PGD is not, it's not a form of prescribing. So what is prescribing that we're used to on an everyday basis in the hospital? Well, not many people know this, but it's actually called a patient-specific direction, and that's where a doctor or a non-medical prescriber assesses the patient, prescribes them a medication, and then asks someone to administer it. So it's a direct instruction, and it doesn't require an assessment by the person who is administering the medication, unlike in a PGD. So putting that into context, if as a non-medical prescriber or a doctor assesses a patient, they then ask you to administer some medication. Yes, you've got your professional accountability. You need to ensure you've got the right medication, the right dose, the right route, its expiry date is correct. You've got the correct patient without allergies, etc. And then you administer your medication. Under a PGD, you actually have to assess the patient and decide that that's an appropriate medication for them, and then administer the medication yourself. So that's the fundamental difference of following a patient-specific direction or a normal prescription and administering a medication under a PGD. So the legal definition of a PGD is a written instruction for sale, supply and or administration of named medicines in an identified clinical situation. It applies to groups of patients who may not be individually identified before presenting for treatment. So the first part of that statement is about the sale, supply and administration. So why does it include sort of sale and supply? Well, if you can use a PGD, for example, to give a TTO, and in the emergency department setting, the patient would actually go and pay for that prescription. So that covers the sale. The supply, like I said, you can use them PGDs to give people TTOs, so you're supplying them to take something away. And then the oral administration, that's what we generally use them for in the hospital setting. So for those instances where you need a stat medication, whether it's analgesia or an injection. We then go on, we'll look at the identified clinical situations. So PGDs are very specific for what you can use certain medications for. So for example, if you had a PGD for an antibiotic for a sore throat, you can use it for a sore throat. If that antibiotic is also the correct antibiotic for another type of infection, you can't use that PGD even though it's the right medication, because the clinical situation is different. And when we look at PGDs, I'll point that out to you. And then finally, it talks about applying to groups of patients who may not be individually identified before presenting for treatment. And that really is about having specific appointments at particular times for particular people, but we don't tend to need to worry about that in the hospital setting. So putting PGDs into context, the majority of the clinical care should be provided on an individual patient-specific basis, and we need to be administering medications under PGDs in limited situations where it offers an advantage to patient care. So it's consistent with appropriate professional relationships and your own accountability. So the criteria of a PGD, you'll see from this slide, it's a very busy slide, but when we write PGDs, we have to include certain criteria, and all of our PGDs are written under certain headings. So this is the format of the patient group directions, or PGD, for our hospital. So I'm going to point out a few key things to you. So in this box here is the named medicine that this PGD covers. So in this instance, I've got ibuprofen mixture, and then I've got some differing strengths. So I've got mixture and I've got tablets, okay? This PGD might have been written for just tablets, not mixture. So I have to be very, very specific that I can only give what's in this box. So it says tablets, it doesn't say IV medications, etc. So you need to be very, very clear, and that box is repeated on the top of each page. We've then got the indication, so the clinical condition. So this one is used for mild, moderate pain, inflammation, soft tissue injuries, or pyrexia. You then have the inclusion criteria, so who can I use it on? And in this instance, I've got an age, a weight, and then an upper age limit. The exclusion criteria on a PGD is very, very important. So unlike a medical, if you're a prescriber, you can sometimes give a medication that may be excluded on here. These are very, very black and white. You cannot vary from the exclusion. So for example, on this PGD, I have an exclusion of asthma. We all know that ibuprofen is a problem for some asthmatics, but some asthmatics can take it with no problems. And as a prescriber, I could make that clinical judgment. Under a PGD, you're not allowed to make a clinical judgment that differs from this exclusion criteria. This is absolute. We then move to cautions, and this is exactly what it says. It's a caution. So you can use your clinical judgment, and as long as you can explain your judgment, then you can do it if it's a caution, but you just need to have a little think about it. And we then have action if the patient declines or is excluded, and that's about documentation and making a referral for medical advice. On the next page, it's all about the medication. So the form, the strength, how I'm going to give it, and this actually reflects what's in this top box. The different dosages, for this one it's covering pediatrics, so I've got a range of dosages here, how often I can give it, and whether I can give it in a TTO pack. So some will have TTO packs, some will not. And then it talks about side effects. Now here we've got quite a limited list, but with you're using a PGD, and I'll explain on the back page later, you have to be familiar with all the sort of common side effects really, and these are the ones that we would normally explain to our patients for that type of medication that we're giving to them, and that sort of comes in with the advice. It may be that if you are giving a TTO, there is some specific advice that you would give them about taking that home, and then follow up is according to whatever protocol or pathway you're using this in conjunction with. The next page is all about you as the staff member. So are you able to use this PGD? So again, we've got the header of what this PGD is covering. We've then got the qualifications that you as a staff member need to have. So this particular PGD, it's a registered nurse with a current NMC registration working in the emergency department, or you're a paramedic working in the emergency department, because we have them working with us. Or a physiotherapist, because on occasion they have worked in the department as well. So the really important bit about this section is if you work, for example, in the emergency department and you have signed a PGD for paracetamol, what you're not allowed to do is, if you're working a bank shift on any other ward in the hospital, you're not allowed to use that PGD in another clinical setting, because it's your individual manager that's authorised you for use in wherever you work regularly. We've then got some specialist competencies, so that you've undertaken specific training, and that's listening to this this session, and that you've done the online training and assessment, which I'll cover in a minute, and you're actually signing to say that you're going to undertake appropriate training for this PGD, and I'll cover that in a minute, and that you're going to do with continuing training, that you will do your annual update, and again we'll cover that in a minute. We've then got a section about audit trails, and within each department who use PGDs, you need to have your manager, and you need to discuss how you're going to set up a regular audit to ensure that the PGDs are being used appropriately. We then have a page that stipulates the information that was used to actually write this particular PGD, and it's the BNF, what edition it is, and the SPC, which is the summary project characteristics, and any other sort of web pages that have been used for this information. And you need to be familiar with this. You need to be familiar with how to use the BNF, how to source an SPC, and these are valid until the expiry date, which is on the bottom of each page. This one's January 2018. And if a new edition of a BNF has come out since this was produced, it's your responsibility as a user to ensure that there are no new changes, no new exclusion criteria, etc., that are still valid for you administering the medication. And a tip I sort of say to people is, if you've signed a series of PGDs, look at the BNF, and every time a new BNF comes out, then just have a quick read to make sure that there are no new changes for the use of that medication. We've then got a page about who has to authorise the PGDs. So certain people in the organisation have to authorise them and sign them. They go through the drugs and therapeutics. And we have lead doctors, lead nurses, lead pharmacists, etc., and clinical governance leads. And then in this box here is the information of the people that actually wrote the PGD. And then quite clearly here it says do not use after the expiry date. It is your responsibility to know your expiry date here. It's also your manager and myself and the pharmacy's responsibility to ensure that they are updated. But if you notice that yours is out of date, please flag that to your relevant manager. And then finally, on the back page, is a really important page. You're basically signing to say that PGDs do not remove your professional obligations and accountability. It's up to you to keep up to date and have relevant training. You're signing to say that you've had that relevant training, that you've read and understood patient group directions, and you agree to supply and administer them according to this particular document. You would then sign, print your name here, sign here. Your manager then signs with a date, and then you have to have a photocopy of the whole PGD with that authorisation in place.